Very good afternoon, friends. Meeting again in the session of Materia Medica. And today we're going to learn one of the important remedy from fourth year syllabus. And even from practice point of view, most important in recent last few years, that is the Eupatorium Perfoliatum. This remedy is also known as bone set, or it is also called a remedy from compositive family. Bone set is the name given to this remedy because it affects the bones specifically. N number of times since last 5-6 years, this remedy is very useful because there are varieties of viral infections which are increasing in the society, in the public, and all those infections, whether it might be a dengue fever, it might be a swine flu, whether it might be a simple influenza, whatever it may be, any flu where bones gets affected and patient is having very severe types of bony pains, one should not forget to use the Eupatorium. In fact, it is one of the important remedy in such types of fever. The how you will know that patient is requiring this Eupatorium. First important indication is that the patient comes to you with very severe body ache. Fever associated with very severe body ache. One first important indication, and patient is becoming restless. Here it goes close to the rest of us. But rest of has very clear cut modality, aggravation during damp rainy weather. Eupatorium doesn't have that specification, but Eupatorium patient always comes to you and says that he is very thirsty and he is having that thirst followed by before the chill stage, during the chill stage, and even during the fever stage. There is a tremendous thirst which is characteristic of Eupatorium. Second important indication that these patients, when comes to you, they never wants to they are not able to sit down because of pain. They want to lie down, and there is very severe type of bony pain, joint pains which are there. The periodicity is characteristically marked in the Eupatorium cases. Marked periodicity. So it looks like to be one of the important remedy in malarial fevers. And there is one characteristic symptom which is mentioned over there, that one day if chill happens at 9 a.m., the next day it will happen in the afternoon. Then third day it will happen in the evening. Next day in the evening. So a marked periodicity, which is a common characteristic of a malarial fever, it's characteristically present in Eupatorium. Hemolysis is again a common thing which happens, and that's why it plays its role more commonly in dengue-like affections. In dengue, they are very characteristically gets affected, having very severe bony pains over there, and patient is absolutely weakened during those cases. So one should not forget this remedy in viral fevers where bony affections are present. Why not to learn this remedy from the Alinsky notes and understand the clinicals from the Alinsky notes? So open your book, Alinsky notes, the Eupatorium Perfoliatum, bone set. It is a composite adapted to diseases of the old people. See, first sentence defines where is the action. Specifically in old people, this plays a very vital role. Worn out constitution, worn out, थकले भागलेले, with who have worked throughout their life, very hard work which has done by them, and they are worn out, especially from inebriety, cachexia from prolonged and frequent attacks of bilious or intermittent fevers, especially from inebriety. Inebriety means those who have done wrong things in their life and exhausted. That is also one indication which has been explained by him. Then second important thing which he explains, cachexia from prolonged and frequent attacks of bilious and intermittent fever. Two types of fevers are mentioned. Bilious fever. Bilious fevers means in fevers where there is jaundice is associated, and that jaundice generally happens to be there because of hemolysis. Malaria, hemolysis happens. Dengue, hemolysis happens. And many times patient suffers from increased levels of serum bilirubin. The jaundice is there. And this is one of the important indication where bilious fevers are there and intermittent fevers. Intermittent fevers, again a malaria. One of the important thing or one of the important intermittent fever is always a malaria. So this is very important remedy, and it is not a, thing which is acute, prolonged or frequent attacks, where it has been tried to suppress it with the modern medicine, but it is recurring and it is not getting settled. Then one must think about the Eupatorium if the pains are very strong at the bony level. Bruised feeling as if broken all over the body. Very, very severe body ache. Very severe. As if someone have bitten them with some strong thing that is like arnica, like Bellis perennis. Then pyrogen. Pyrogen is also having, but pyrogen it is very specifically the septicemic state which is present. In pyrogen, you get the clear cut tongue, clean as if varnished. And second important thing, the relative tachycardia, which we have discussed earlier. Relative tachycardia is common with the pyrogen. Then he has mentioned about the Bellis perennis is the remedy where generally such a feeling is there in muscular rheumatism. In arnica, the same feeling is there because of trauma. Here there is no trauma, but here there is a fever, intermittent type, bilious type, viral type, and the patient is suffering from severe body ache as if bones were broken. That typical feeling, bruised feeling all over the body. Bone pains affecting the back, the head, the chest, the limbs, especially the wrist, as if dislocated. Chikungunya fever, that was another common example of it, where this remedy played a vital role. So joints gets affected in during the fever, and that fever which was there in 2007 and recently nowadays also at many places this chikungunya fever is there. This is one of the remedy one should not forget. The more general and severe, the better adapted. So see the what it indicates. The more general and the severe, the better adapted. The so severe and all over the body, if it is joints are affected and it is of a severe type, then always think of Eupatorium first. This is very important thing. And he mentioned over there, compare the Bryony. Yes, Bryonia is one more remedy where you get such types of fever. But bryonia is associated with dryness of mucous membranes. Marked characteristic in bryonia is dryness. Bryonia, there the dryness of mucous membranes, dryness of the skin, associated with severe thirst for large quantities of water at a long intervals, with associated with absolute constipation or stools are dry hard. These are indications in Bryonia, and Bryonia feels better by rest. Bryonia wants to lie down in a quiet position because slightest motion aggravates. In Eupatorium, it is not so. Eupatorium becomes absolutely restless. Then he mentions one more remedy he has mentioned over there is mercurius. Mercurius he has mentioned over relation with the thirst. This is also a thirsty remedy. Mercurius is also a thirsty remedy. In mercurius, sweating is the characteristic over there. Painful soreness of the eyeballs. The eyeballs become so sore, so painful. And this happens generally in such types of viral fever, dengue, chikungunya, malaria. The patient complains that there is severe pain in eyes. Coryza aching in every bone, great prostration in epidemic influenza. And that this is very important. Epidemic influenza followed by a severe prostration. Eupatorium is first remedy one should not forget. Here he mentions laccan also. But laccan has very different aspect. Laccan is also a remedy for intermittent fever, but laccan is very specifically having changeability. Changeability from right to left, left to right, again it is in reverse order changeability, which you can get over there in leccan. Leccan, many complaints are aggravated before menses in females. That is another characteristic of leccan. Leccan is also having associated delusions and dreams of snakes. That is another important feature. Then leccan is having very severe sore throat, the congestion of breast before the menses. So many things with which can be presented. Pains comes quickly and goes away quickly, like belladonna, like macpos, like Eupatorium purpurium. That is another clothes colleague of Eupatorium purpurium. So it is an acute remedy where the pace is very acute, the pains comes very short duration, and it remains for short period, goes away quickly. So belladonna is a remedy from acute miasm. In the similar manner, Eupatorium also has the similar types of pain. Vertigo. Vertigo, there is sensation as if falling to the left. Cannot turn the head to the left for fear of falling is colocynth. So see, there are remedies he compares over there. Vertigo, where patient feels that he will fall to the left side, very characteristically. Vertigo is very thoroughly explained in the homeopathy. When patient is rising up from the bed and vertigo is there, then bryonia is the remedy. When patient is lying down, turning in the bed from one side to another side, that is conam maculatum. When patient is bending forward or bending backward, the vertigo is there, the sulfur is the remedy. Varieties, modalities defines the vertigo in homeopathy, and varieties of vertigo are mentioned over there. Here there is a sensation as if patient will fall down to the left side. Cough. This is again a good remedy for influenza, and that's why cough is one of the important feature. Cough, it is chronic, loose with hectic, sore, chest is sore, must support it with hands. It is very close to the bryonia and natrum cough. Bryonia, it is because of the cough, which is of a pneumonitic type, and patient is coughing so strongly, and he is having pain. For that purpose, in order to prevent the pains, the bryonia wants supports. Even bryonia is a good remedy for pleurisy over there, and slightest movement affects the pain over there in bryonia. Aggravation, cough is aggravated at night following measles and suppressed intermittence. So after the measles, if cough is persistent, one must think about this remedy if it is associated with bony pains. Intermittent fevers during which the cough happens, it is one of the important remedy. Fever, the chill to the 9 a.m. one day, at noon the next day. See the periodicity. This is characteristic periodicity of this remedy. And that's why this is one of the remedy in intermittent malarial fevers. Bitter vomiting at the close of chill, that is one more feature. At the end stage of the chill, there is a vomiting, and vomiting is of bitter matter. Drinking hastens the chill. So when the patient drinks, it hastens the chill, it increases the chill, causes vomiting, bone pains before and during chill. And bony pains is the characteristic of Eupatorium, whether it is chill, whether it is hot stage, or whether it is sweating stage, whatever stage, the bony pains are continuous over there in the Eupatorium. Irresistible thirst before and during chill and fever. Knows chill is coming because he cannot drink enough. So patient is continuously drinking and drinking. He feels that now I will going to get a chill. That is an aura specifically happens in Eupatorium, and that indicates that patient is requiring the Eupatorium. Relationship, it is followed well by natramur and sepia, the depicting remedies after Eupatorium, natramur and sepia. Natramur is also one important remedy for intermittent fevers, malaria-like fevers, or chronic malaria. And if you want to cover whole story, natrum plays the role. And even after natrum, something remains. Then sepia covers the total because it is again complementary to the sepia is complementary to the natramur. Compare chelidonium for affections, bilious affections. Podophyllum, again for the similar thing. Podophyllum is a very good remedy for summer diarrhea. Lycopodium in jaundiced conditions. All three remedies, specifically when liver is at fault, and There is a biliousness which develops over there. These three remedies one should consider while comparing it with the Eupatorium. Bryony is the nearest analog, having the pre-sweat but pains keep patient quiet, while Eupatorium has scanty sweat and pains makes patient restless. See, this is the basic difference between two remedies. Euphrasia, you'll get much less sweating as compared to the Bryonia, and patient is becoming restless because of pains. So this is very important thing which he has mentioned about the Eupatorium. One remedy one should not forget in intermittent fevers, in dengue fevers, in viral fevers, in specifically when there is a bones which are affected or joints are affected, generalized joint severe pains are there. One must consider the Eupatorium perfoliatum. You can repeat this at frequent intervals for 1 day or 2 day, and you can wait for the results. General potency, which I used to use in cases, is 200. Eupatorium perfoliatum 200 is the best potency. Very occasionally, you might require Eupatorium 1 m, but 200 is sufficient to tackle the attack of a influenza or dengue or even malarial attacks. You can control with the help of 200. Three doses are more than sufficient. Occasionally you have to repeat it next day. So this is a wonderful remedy which we have learned in today's session, the Eupatorium perfoliatum. Go through it from Borix Mathematica, so you will learn a different aspect of it, few more details about the remedy, and you can understand a better perspective of the Eupatorium. Thank you, and we'll meet again.